Is your brain functioning well, or could there be an issue? Have you ever walked into a room and forgotten why you went there in the first place? We all have those moments of forgetfulness, but when should you be concerned? Dementia is a sneaky condition that affects over 55 million people worldwide, making it a leading cause of disability and dependency among the elderly, as well as the 7th leading cause of death globally. You might think you're too young to worry, but changes in brain neurons can begin decades before symptoms appear, which is why recognizing the early signs is essential and can make a world of difference. So keep watching to explore the subtle symptoms of dementia that you should never ignore, ensuring you or your loved ones get the help needed sooner rather than later. But first, please like the video to help it reach more people, especially those without access to medical care. The first early warning sign to look for is postural changes. Early postural changes can be difficult to detect as they are often mistaken for normal aging or muscle weakness. These changes can include an altered gait, such as walking with shorter or slower steps or dragging feet. Coordination problems might also arise, making tasks like holding a cup or using utensils challenging. Additionally, the person may become more hunched or lean to one side. These subtle changes are easy to miss if you are not specifically looking for them. Number 2. Sensory changes. Dementia can affect sensory organs, leading to issues that family members might not immediately notice. Individuals may experience problems with depth perception and spatial awareness. Changes in taste and smell can occur, leading to a diminished ability to sense odors. There can also be increased noise sensitivity, making everyday sounds overwhelming. By staying alert to these early signs, you can seek help sooner, potentially slowing the progression of dementia and improving quality of life. People with dementia often become extremely sensitive to noises, making it difficult for them to cope in busy environments like supermarkets or shopping malls. Additionally, they may start to lose their hearing, which requires treatment. A study published showed that hearing loss in middle age is associated with a higher risk of dementia, and may be the most important modifiable risk factor for preventing dementia in the future. Poor hearing forces the brain to work harder to decipher the confusing signals the ears send, so addressing hearing loss early is crucial. Number 3. Muscle strength problems. Muscle strength is closely linked to Alzheimer's disease, which is much more common in women, with 2/3 of cases occurring in women. While it was once thought this was due to women living longer, men are now catching up in life expectancy, yet the disparity remains. A study involving over 1,000 women with an average age of 75 found that those with a weaker grip test were twice as likely to develop dementia in the future. Therefore, frailty in the elderly is a significant risk factor for dementia. Number 4. Sleep problems. Changes in sleep patterns can also signal dementia. This can include excessive daytime sleepiness, where someone who never napped before now feels the need to nap in the afternoon, as well as insomnia, fragmented sleep, nightmares, vivid or intense dreams, and restless sleep syndrome. In the latter, the person moves excessively in bed involuntarily, possibly kicking, punching, screaming, or groaning. Poor sleep quality is both a sign of and a contributing factor to dementia. Number 5. Apathy. Apathy, or anhedonia in technical terms, can be an early symptom of dementia. Watch for changes in behavior where someone who used to enjoy various activities such as dancing or shopping now shows no motivation or interest. They may withdraw from family events and lose interest in the things they once found pleasant. Recognizing these signs early can make a significant difference in managing and potentially slowing the progression of dementia. While various psychiatric conditions such as depression and anxiety can cause apathy, in dementia it is an early symptom. The death of neurons leads to changes in neurotransmitters that regulate emotions. Number 6. Difficulty finding words. You might notice that a person with early dementia has trouble finding the right words during a conversation. Sometimes they might use a related word that's not quite right, like saying blouse instead of jacket. This difficulty is known as aphasia. It was one of the first signs exhibited by Bruce Willis as he became unable to remember the words he was trying to say. It may also affect your ability to remember the names of people you know very well. Again, this is why detecting dementia early makes it easier to treat and can significantly improve the person's quality of life. Now, I think it's important that we discuss the causes of dementia. Dementia is a complex and multifaceted condition caused by various underlying factors that affect the brain's structure and function. The most common cause is Alzheimer's disease, characterized by the buildup of amyloid plaques and tau tangles, which disrupt neural communication and lead to brain cell death. Vascular dementia, another prevalent type, results from reduced blood flow to the brain due to stroke or other vascular conditions, leading to cognitive decline. Lewy body dementia, marked by abnormal protein deposits called Lewy bodies, also impairs brain function, often causing fluctuations in attention and alertness. Additionally, frontotemporal dementia arises from the progressive degeneration of the frontal and temporal lobes, affecting behavior, language, and personality. Other contributing factors include chronic alcohol abuse, certain infections like HIV, and neurodegenerative diseases such as Parkinson's disease and Huntington's disease. Genetic predispositions and lifestyle factors such as poor diet, lack of exercise, and smoking further influence the risk of developing dementia. Understanding these causes is essential for developing effective prevention and treatment strategies. Preventing dementia involves adopting a multifaceted approach focused on maintaining overall brain health through lifestyle modifications and managing risk factors. Engaging in regular physical exercise is crucial as it promotes cardiovascular health and enhances blood flow to the brain, reducing the risk of vascular-related cognitive decline. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports brain function and can help prevent conditions like obesity, diabetes, and hypertension, which are linked to dementia. Mental stimulation through activities such as reading, puzzles, and learning new skills keeps the brain active and may enhance cognitive reserve, potentially delaying the onset of dementia symptoms. Social engagement is equally important, as maintaining strong social connections can mitigate stress and depression, both of which are risk factors for cognitive decline. Additionally, managing chronic conditions like diabetes and high blood pressure, avoiding smoking, and limiting alcohol consumption are vital steps in reducing dementia risk. Ensuring adequate sleep and managing stress through mindfulness practice or therapy also contribute to brain health. By embracing these preventative measures, you can significantly lower your chances of developing dementia and maintain cognitive function well into later life. Furthermore, scientists are cautiously optimistic about the future of Alzheimer's treatment, driven by recent advances in research and a better understanding of the disease's underlying mechanisms. Over the past few years, significant progress has been made in identifying the genetic, molecular, and cellular factors that contribute to Alzheimer's, leading to the development of new therapeutic treatments. The advent of disease-modifying treatments, such as drugs that target amyloid plaques and tau tangles, has shown promise in clinical trials, offering hope for slowing or even halting the progression of the disease. In addition to pharmacological treatments, there is growing interest in lifestyle interventions and their role in preventing or delaying the onset of Alzheimer's. Research on the impact of diet, exercise, cognitive training, and social engagement is expanding, providing a more holistic approach to managing the disease. However, this all leads back to the most essential step, which is to recognize the early warning signs of dementia that we discussed throughout this video. Have you experienced any of the symptoms, or do you have a friend or family member with dementia? If so, let us know and share your experience down in the comments section below. And be sure to watch some of our other helpful videos that are popping up on your screen right about now. And just a quick reminder, we are not doctors. This video is for informational purposes only.